Welcome to On Call with Dr. Anselm Anyoha. Today's episode focuses on a condition that affects millions of children worldwide, but is often overlooked until it begins to interfere with a child's health and development. Anemia in babies and young children. Anemia is not just a number on a blood test. It affects a child's energy, growth, learning, and emotional well-being. While there are several types of anemia, today we will focus on iron-deficiency anemia, the most common form seen in infants and children. Across the world, hundreds of millions of children are affected by iron deficiency. Understanding its causes, warning signs, prevention, and treatment is essential for every parent and caregiver, because this is a condition we can both prevent and treat effectively.
Dr. Anyoha, many parents hear the word anemia and immediately worry, but they may not fully understand what it means. Can you explain what anemia is in simple terms, and why iron is so important for babies and young children?
Anemia occurs when the body does not have enough healthy red blood cells or enough hemoglobin to carry oxygen throughout the body. Oxygen is the fuel that powers every cell, tissue, and organ. Iron is a critical building block of hemoglobin. Without enough iron, the body cannot make adequate hemoglobin, and oxygen delivery becomes inefficient. When this happens, babies may become tired, pale, less interactive, and less interested in feeding or play. Over time, iron deficiency affects growth, brain development, and the ability to learn. That is why anemia in early life is taken so seriously.
What are the most common reasons babies and young children develop iron deficiency anemia, both in high-income and resource-limited settings?
There are several common pathways to iron deficiency anemia. One is low iron intake, especially in babies who consume diets lacking iron-rich foods. Another is exclusive breastfeeding beyond 4 months without iron supplementation. Breast milk is excellent, but it does not contain enough iron to meet a baby's needs after the early months. Premature babies are also at higher risk because they miss out on iron transfer from the mother during the last weeks of pregnancy. After 12 months of age, excessive cow's milk intake can contribute to anemia. Cow's milk is low in iron and can cause small amounts of intestinal blood loss. In some children, anemia is caused by blood loss, infections, or parasitic diseases, especially in parts of the world where malaria and intestinal worms are common.
Parents often wonder what anemia looks like in real life. What signs and symptoms should parents watch for, and why is anemia sometimes missed?
Some symptoms are subtle, while others are more obvious. Parents may notice pale skin or pale eyelids, fatigue, low energy, or poor appetite. Some babies breathe faster than usual, or seem less playful and interactive. Other signs include poor growth, delayed milestones, or unusual cravings such as eating dirt, paper, or ice, a condition known as pica. The challenge is that many children adapt quietly. They function below their potential without dramatic symptoms. That is why routine screening during pediatric visits is often the only way anemia is detected early.
How do pediatricians usually diagnose anemia, and at what point does a blood test become concerning?
We diagnose anemia with a simple blood test that measures hemoglobin. Normal levels vary by age, but in young children, a hemoglobin level below 11 grams per deciliter raises concern. Sometimes anemia is discovered incidentally, for example, during an emergency room visit for fever or diarrhea. In my practice, routine screening often identifies anemia in children who otherwise appear healthy and active. That is why scheduled well-child visits are so important.
If anemia is left untreated, what are the potential short and long-term consequences for babies and young children?
The effects of untreated anemia go far beyond fatigue. Anemic children may experience cognitive delays, making it harder to learn and retain information. They may show behavioral changes, such as irritability, poor engagement, or reduced play. Growth can be affected, leading to slower weight gain and height increase. Over time, these early deficits can translate into reduced academic performance and productivity in adulthood. Anemia is not just a childhood issue. it can shape a child's future.
Prevention is always better than treatment. What practical steps can parents take to prevent iron deficiency anemia in their babies?
Prevention starts early. Breastfed babies should receive iron supplementation starting at 4 months. Formula-fed babies usually receive enough iron from iron-fortified formula. Iron-rich complementary foods, such as fortified cereals, can be introduced between 4 and 6 months. After 1 year of age, children should eat a balanced diet that includes meats, fish, beans, lentils, tofu, and leafy green vegetables. Cow's milk intake should be limited to less than 24 ounces per day. Routine screening during pediatric visits is essential. In many resource-limited settings, public health programs recommend periodic iron supplementation to reduce the overall burden of anemia.
Once anemia is diagnosed, what treatment options are available, and what should parents know about iron therapy?
Treatment depends on how severe the anemia is. Mild cases often respond well to dietary changes and oral iron supplements. Moderate to severe anemia may require higher doses of iron, and in some cases, hospitalization. It is also important to treat underlying causes, such as infections, parasitic diseases, or sources of blood loss. Parents should follow dosing instructions carefully. Too little iron will not correct anemia, and too much iron can be harmful. Follow-up blood tests help ensure treatment is working safely.
As we wrap up, what final message would you like parents to remember about anemia in babies and young children?
Anemia is common, but it is preventable and treatable. Parents should remain attentive to nutrition, supplementation, and routine screening. A child who appears pale, tired, or unusually irritable may be anemic, but many children show no obvious signs at all. That is why regular pediatric visits and blood tests matter. Iron deficiency anemia steals energy, growth, and learning potential. Addressing it early helps babies thrive, supports brain development, and allows children to reach their full potential. Thank you for joining me on Call with Dr. Anselm Anyoha. If you found this episode helpful, please share it with friends and family, especially parents of young children.